A bone fracture, in the simplest terms, is a break. It represents a disruption in the continuity of a bone, a structural failure under stress. Think of a bone as a strong yet slightly flexible column supporting a building. When force exceeds that column's capacity, it cracks or shatters. This is what happens inside the body. The force can be sudden and high impact, like a car accident, or a fall from a significant height. Or it can be repetitive, lower-grade stress. For example, repeated impact from running, a stress fracture. The result? The bone's integrity is compromised. That leads to pain, swelling, and loss of function. For the physical therapist, understanding this is step 1. A fracture is more than mechanical. It's a biological injury that starts a complex healing cascade. Damage affects bone, periosteum, and surrounding soft tissues. Blood vessels can rupture, causing bruising and edema. Not all fractures are created equal. They come in many different forms, each with its own implications. One distinction is a closed fracture, where the bone is broken but the skin remains intact, versus an open or compound fracture where bone pierces skin. This is far more serious due to infection risk. A transverse fracture is a straight horizontal break, often from a bending force. An oblique fracture runs at an angle, typically from angulated or twisting forces. A spiral fracture encircles the bone, almost always caused by rotation, common in sports with a planted foot. Recognizing patterns reveals the forces the limb endured. Comminuted fractures break bone into several pieces and follow high-impact trauma. They are challenging to stabilize. Greenstick fractures are incomplete, like a young twig. One side breaks and the other bends. Typical in children. Buccal fractures compress and bulge without a full break, also common in kids. Avulsion fractures occur when a tendon or ligament pulls a small piece of bone away. Stress fractures are tiny cracks from repetitive loading, often in athletes. Impacted fractures jam ends together. Knowing this language lets you read reports and communicate precisely. The human body possesses a remarkable, factory-installed system for repairing broken bones. This process unfolds in overlapping stages, a biological blueprint for reconstruction. It begins immediately. Blood vessels tear and bleeding forms a fracture hematoma, the critical first step. The clot stops bleeding and provides structure plus signaling to kickstart healing over the first few days. Next, days to weeks. The hematoma is replaced by a soft callus. Fibroblasts build a collagen bridge. Chondroblasts produce fibrocartilage, creating a soft, rubbery span. It offers initial stability, but needs protection from weight bearing. Then soft callus mineralizes into woven, hard callus, like turning a scaffold into concrete as osteoblasts lay minerals. Over months, a bony callus forms, and the fracture grows more rigid, visible as a lump on X-ray. Gentle, controlled loading may begin under therapist guidance. Finally, remodeling refines the bulky callus back toward original form and strength, a process lasting months to years. Osteoclasts remove excess bone, while osteoblasts deposit organized compact bone along stress lines. Healed bone becomes as strong or stronger. Your guided mechanical stresses help direct this remodeling. Section 4. A helping hand for healing. The role of orthopedic devices. While the body heals fractures, devices support and protect to create optimal conditions. Their fundamental goal is immobilization, holding fragments in alignment and preventing motion. Without adequate immobilization, malunion or non-union can occur. Serious complications. Stabilizing reduces painful motion of bone ends against nerves and soft tissue. Compression can also manage swelling and promote circulation. Modern devices immobilize what needs it while permitting motion at adjacent joints for earlier mobility. Example: a tibial functional brace stabilizes bone, yet allows some ankle and knee motion. Device choice depends on fracture type, location, stability, patient age and health, and surgeon preference. As a PT, know the device's purpose and stability. It defines safe, effective rehab boundaries. Section 5. The toolkit of recovery: casts, splints, plates, and more. Splints are used immediately post-injury, a rigid support on one side, secured with elastic wrap to accommodate swelling. After swelling subsides, patients often transition to a cast that provides circumferential rigid support. Modern casts use fiberglass, lighter, more durable, and more water-resistant than traditional plaster. The cast holds alignment through soft and hard callus formation, protecting the delicate cartilage bridge. Complex or unstable fractures may require internal fixation. Surgeons implant plates, screws, intramedullary rods, or wires to hold fragments from the inside. A plate acts like an internal splint. An IM rod spans the medullary canal to maintain alignment. Rigid internal stability can allow earlier ROM and weight bearing while hardware shares the load. When you see internal fixation, assume structural stability. Guide safe motion and strength around the hardware. Choose the right tool at the right time to protect healing and enable function. Section 6. The physical therapist's crucial role in fracture recovery. Your work begins once the device is in place. Manage pain and swelling, maintain surrounding function, and educate. Teach safe mobility with crutches or sling, and prescribe ROM for joints above and below the fracture. Introduce isometrics to slow atrophy, sustain neuromuscular control, and support blood flow. After immobilization, expect joint stiffness, muscle weakness, and fear of movement. Progress ROM gradually, passive, then active assistive, then active, always monitoring response. Build strength with progressive resistance, and for legs, advance weight bearing from partial to full as tolerated. Section 7. Guiding the journey back to strength. A final word for PTs. A fracture triggers a predictable, remarkable healing cascade, from hematoma to remodeling. Orthopedic devices are the silent partners creating the stable environment for solid union. Understanding fracture types and healing stages gives you a roadmap: when to protect, when to move, when to strengthen. You mitigate atrophy and stiffness, reintroduce load, and transform a healed fracture into a functional limb. Never underestimate your impact. With precision and compassion, you are a critical architect in the reconstruction of human movement.